Hey everyone, it's Hannah, the PBC Expo Midwife. In this session, we're going to be focusing on your labour. So we're going to be covering some important topics like the different stages of labour, how to know when to go to hospital, what your support person can do to help you, and what techniques you can use to help you manage your labour. So let's start by looking at your hormones. Your hormones are so important when it comes to labour and birth, and they initiate a lot of the processes that drive what's happening with your labour. So the first hormone we're going to go into is prostaglandin. This is a hormone that helps the cervix to soften. So the cervix during pregnancy needs to stay firmly closed, but then once labour begins, it needs to open to allow your baby to pass through and to be born. So prostaglandin helps the cervix to become really soft and stretchy in the last few days or weeks of pregnancy. So it's a really important hormone. From there, oxytocin is the next big hormone. Oxytocin is a hormone that we produce at many different points in our life, but the biggest surge of oxytocin that we ever have is when we're in labour and when we have our baby. It's a really important hormone to assist with bonding and connection with your baby, but it also has a really important role in labour. And that's because oxytocin causes the uterus to contract. So without oxytocin, we wouldn't have contractions. So it's a really important hormone for labour and labour progression. Synthetic oxytocin is a medication that's often used to assist in getting labour started as part of an induction or to help speed up labour. And it's important to note that synthetic oxytocin does work differently in our body because it doesn't have that same effect on our mind and that same bonding ability that our own body's oxytocin has. Beta endorphins are the next important hormone. So our endorphins are our body's natural painkillers, and we want them to be as high as they can be during labour. All women will secrete endorphins to some extent in labour, but some women secrete more than others. So they're really powerful and they help us to manage the intensity of our contractions. The next hormone that we will discuss is adrenaline. So adrenaline is part of our stress response, and it's part of that fight or flight reaction that we have in our body. So what's really important to know during labour is that high levels of adrenaline, particularly in early labour, can actually slow down or inhibit the progression of labour. So we want to keep our stress levels and our adrenaline response really low throughout labour. It is normal for women to have a peak of adrenaline right before their baby's born, and that gives them that last boost of energy to be able to birth their baby. And that's really normal. The last hormone that I'm going to cover is relaxin. So this is a hormone that helps to soften all the ligaments in our pelvis. And this is important because it helps to create space for your baby to be able to move through the pelvis and to assist in them being born. So we do know that certain interventions during birth can interfere with this delicate hormonal balance. So particularly epidurals can alter our body's level of endorphins and oxytocin. And as I mentioned earlier, that synthetic oxytocin can alter how our own body's natural oxytocin system is working. So these hormones do have a really delicate balance. When considering interventions, it's important to look at how they may affect the hormones and how they may impact your labour and birth. So now let's look at the different stages of labour. So there's 3 stages of labour that we refer to. The first stage of labour is where the cervix is thinning and opening, and this can be separated into early labour and active labour. Early labour is when the contractions are quite sporadic and irregular, and this can last for hours or even days. So it's important to chill out, rest, maybe go for a walk or watch movies in this time because there's no hurry. We just need to wait for your body to move into the active labour phase. Active labour is then where the contractions are coming really regularly. So women are having 3 contractions within every 10-minute period, and each contraction is lasting about 60 to 90 seconds. That's what we refer to as active labour. So the second stage of labour is from where the cervix is fully dilated or fully open to the point where your baby is born. And this is often referred to as the pushing stage of labour. So this can last 1 to 2 hours, although this is often less if it's not your first baby. The third stage of labour is from when your baby is born until the placenta is birthed. So the placenta is an organ that your body grows to nourish your baby during pregnancy. But once your baby's born, your body doesn't need it anymore. So once you've given birth to your baby, you will then birth your placenta. So advocacy and decision making is really important to consider when you're preparing for your birth. Get as informed as you possibly can. Learn as much as you can about your body and what to expect during labour. Learn about common interventions. Learn about ways that you can support your body during labour, ways that your partner can help you. This all really contributes to having a positive birth experience. Advocacy is really important during labour, and it's important to know that you have someone who knows what your wishes are and who can advocate for you if the opportunity arises. So this may be your birth partner, And that may be your romantic partner, or it might be your mum or your sister or a close friend. Or you may opt to use a doula during your pregnancy. So a doula is a non-medical support person, and they are trained in labour and birth. So they can provide a lot of physical and emotional support during labour, and they can also really advocate for you and your baby and the wishes that you and your partner have for your birth experience. This is important because for a woman to labour really well, she needs to be able to switch off the thinking part of her brain. And having someone there that knows what she wants, can advocate for her, it makes a big difference in allowing her to work with the sensations that her body's giving her in labour and to kind of go with the flow of what her body's doing. I would encourage you to research the pros and cons of your different options and different interventions during your labour. Discuss them with your partner and then discuss them with your care providers as well, so that you can feel like you're all on the same page. It can be really great to discuss a plan A, a plan B and a plan C to cover you in different scenarios, but we will talk about birth plans later on in this session. Now let's talk about the role of the birth partner. As a birth partner, you have such a huge role in labour and birth, and you can make a brilliant difference to your partner's experience of labour. You guys are going to be working as a team to raise this baby, so I think it's really important to work as a team during your pregnancy and during your birth. So as a birth partner, you can have that role in advocating for your partner, of communicating her wishes with your care provider so that she can switch off during labour. You can also provide a lot of physical and emotional support. So you may be able to do things like massage or acupressure points, or even just holding a shower head over her belly. Things like that that can allow her to relax in labour and to feel like someone is there for her and able to provide that support. Emotional support is also really important. Lots of women benefit from having positive encouragement during labour. So as a birth partner, saying things like you're doing a great job, just focus on each contraction at a time, work with your body, this is normal, this is good. These things can be really, really helpful for helping a woman to manage her labour and her birth. There's also some really interesting research around holding a loved one's hand and actually lowering our perception of pain. And I think that's pretty incredible. So as a birth partner, just being close, providing that physical support can not only help your partner with her pain in labour, but it also helps that oxytocin, because that's that hormone that is produced when we feel love and when we feel connection. So anything like cuddling, hugging, massage, physical touch in labour is something that as a birth partner, you can have a huge impact on. The most common question that I get asked is when to go to hospital when you're in labour. This is a really personal decision, and most women will have an instinct where they feel like they need to go to the hospital. They feel like they need to go where they're going to be giving birth. But as a bit of a rough guide, I suggest to labour at home until you're having 2 to 3 contractions in every 10-minute period, and they're coming really regularly. So they're not having big gaps in between. They're regular, they're nice and strong, lasting about 60 seconds for each contraction. At this point, I recommend contacting your provider, whether that's your midwife or obstetrician. And if you want to stay in labour at home for longer, this is often a great option for women. So discuss that with your care provider if it might be right for you. There are a number of brilliant strategies and tools that you can use to help you manage the sensations of labour. And I'm going to cover the top ones that I think work really well. So the first one is breathing. If you can focus on slowing down and regulating your breathing, this can have a really great impact on your ability to manage the intensity of your contractions. Unfortunately, when we're in pain or we're uncomfortable, we often tense up and we hold our breath, which is the opposite of what we want to be doing in labour. We want to keep that breath flowing and keep focusing on that slow breath in and out. And that can help a lot of women to manage through their contractions. The next technique that is a great option is movement. So for most women, if they're able to move around, they're much more comfortable in labour. So that might be standing, it might be rocking from side to side, it might be walking around, but you'll probably find that you're much more comfortable and able to manage the contractions more easily if you're upright rather than being laying flat on the bed. That's where most women find they get the most discomfort, and particularly pain and discomfort in their lower back area. So movement is really key. And I really believe that all women should be encouraged to move to whatever position works for them for their labour, and that's supported by lots of current research and evidence. The next technique that is brilliant is the use of water. So whether this is in a bath or in a shower, it can really help you to relax. And remember, when we refer back to the hormones, that relaxation in labour is so important. We keep the adrenaline levels low so that the oxytocin and the endorphins can build up as they're designed to. So being in a warm shower or a warm bath can help women to relax. That warm water flowing over their back can also be quite a good distraction during their contractions. The next option that's great to consider is a TENS machine. So this stands for Trans Electrical Nerve Stimulation, and it's a small battery operated device with 4 electrodes that are attached to sticky pads that connect to your lower back. How a TENS machine works is that it provides a sensation that interrupts the nerve pathway back to the brain, or the pain pathway. So it's a great pain management technique in labour. It's also thought to work by helping your body to release your natural endorphins or your natural pain relief. So I think TENS machines are absolutely brilliant when it comes to labour and birth. There are specific TENS machines that are designed for labour and birth, and these have a boost button that help to increase the sensation during a contraction, so it gives you that extra effect. Massage is another really great technique to use in labour, particularly around the hips, the glutes, the lower back area. A lot of women find that this helps them to manage. Even what we call counter pressure, which is holding firm pressure in one spot. This can be particularly helpful if women are feeling discomfort from their contractions in their back. As a birth partner, massage is something that you can do that can have a really great impact, and I would encourage you to try out some different massage techniques during your partner's labour. A lot of women also find heat very beneficial, and again, it can help the muscles to relax. So holding a heat pack on your lower belly or your back can be really beneficial. Hypnobirthing is another technique that a lot of women will use to help them manage the intensity of their labour. Hypnobirthing is about using self-hypnosis to help you get into a relaxed state during labour. And hypnobirthing courses also teach you and your partner lots of other techniques. So this might be something that you want to look into for your birth. I really encourage you to try different techniques during your pregnancy. The more comfortable you can get with them during your pregnancy, the more likely you are to use them during your birth. And make sure that your birth partner knows how they can support you as well during your labour. I'm often also asked about the medical pain relief options that are available to women in labour. So there's three main ones, and these include gas, narcotic or opioid medications, and an epidural. So I'm going to go into all three. Gas is a combination of nitrous gas and oxygen, and it can be started at quite a low dose and then turned up as needed. To use the gas during labour, a woman will breathe on a mouthpiece during her contractions, and the medication is absorbed into her lungs. So the gas can be a great option because it doesn't restrict your ability to move around, and often women can still use the bath and the shower while using the gas. So it's a great entry-level option to try if you feel like you might be needing something more. Some women do report that they feel nauseous or a little lightheaded, but usually this does resolve once they stop breathing the gas and just breathe normally for a short period of time. The gas is also something that can be stopped if you find that you don't like that sensation. Then let's move into the opioid medications. So this includes things like pethidine, morphine and fentanyl. Narcotic or opioid medications refer to things like pethidine, morphine and fentanyl. These vary widely by hospitals, so I would encourage you to chat with your midwife or doctor about what is on offer at your hospital for your birth. These medications are usually given via an injection, and they can produce a strong pain relieving effect that can last up to a couple of hours depending on which medication is used. For some women, these medications do make them a little bit drowsy, and for that reason it may not be as easy to move around, and some hospitals may not recommend that you use the bath or shower for a period of time after having those medications. So it's important to consider this for your birth. An epidural is an anaesthetic medication that's injected into the spine, and what it does is it alters the sensation from the waist down. It's a very effective form of pain relief in labour, but it does have some considerations that are important to think about. The first one is that it does have quite a considerable impact on your ability to move around. Most women with an epidural will need to be in the bed. Occasionally they're able to stand up, but the vast majority of women will then need to be labouring in the bed. It also usually means that women will have a catheter, which is a small tube into their bladder, an intravenous drip with fluids running, and also continuous monitoring of their baby's heart rate, which is 2 straps around the tummy. So it is quite different to the other forms of pain relief. However, it can be a great option for women who are very tight in labour, and it can give them a good opportunity to be able to rest. With your medical pain relief options, knowledge is power, and it's all about learning about the pros and cons of different options so that you can decide what you would like to use during your labour. The choice is 100% yours, but it's important to know what options are available and what you'd like to do when the time comes. It's important to know with an epidural that a needle is used to place the epidural in your spine. However, the needle is removed and only a small plastic tube is left in the spine. This is removed after the birth, so an epidural can provide quite consistent pain relief throughout the duration of your labour. Your midwife will either top up the medication throughout your labour to provide that consistent pain relief, or you may be provided with a patient-controlled epidural anaesthetic where you have a button that you press to keep that epidural working. Birth plans are a really hot topic. As a midwife, I absolutely love birth plans, and I think they can be a crucial part of having a positive birth experience. So at its basic level, a birth plan is about getting clear on what you want for your birth, communicating that with your partner, and then communicating that with your caregivers. For a lot of women in Australia, they may not know the midwife or doctor that's on the day when they go into labour. So by creating a birth plan before, it can provide a really effective communication tool on the day of their labour. And it can mean that you don't have to have really lengthy discussions and pros and cons chats about different things in labour. If you've created your birth plan, your partner can then discuss this with your midwife and you know that your wishes have been voiced with them. As a midwife, birth plans help me to support a woman to achieve the birth that she wants. So birth plans are not all about a natural birth. It's about really considering what you want and making sure everybody in your care provider team is on the same page with that. So when you're creating your birth plan, just start by thinking about what things are important to you during your birth. Think about whether you would like the ability to move around. Perhaps you would like to use the shower or the bath. Maybe you would like an epidural, or you'd like your partner to be using certain techniques. Things like that are good to include in your birth plan. Also research those things like the common interventions such as inductions and cesareans and the different pain relief options, and think about what options you maybe do and don't want and list these in your birth plan. It's often good to think about your birth plan as preferences or as listing what you would like. It's not a blueprint of exactly how your birth's going to go. We know that we can't control every aspect of birth, and there are sometimes things that are unpredictable, but what we can do is go into it with a game plan. I always say that you wouldn't arrive on your wedding day without any planning or preparation, or without putting anything in place. So giving birth to your baby is one of the biggest, if not the biggest day in your life, so we should still be putting in that same preparation and planning for that day as well. Even on your wedding day, you know that things may not go exactly to plan. It might rain or you might be running late, but you still plan and you still put a plan in place. And when it comes to labour and birth, we want to be doing the same thing. So when you are creating your birth plan, list those things that you want, think about different options, and then really discuss it with your care providers. And I recommend to discuss it with them by 36 weeks of pregnancy. This is important so that you can make any tweaks, or you can discuss your options with them and they may provide specific advice to you and your pregnancy. So for example, if you are really wanting a water birth, you want to have that in your birth preferences or your birth plan, because you might have this discussion with your midwife at 36 weeks and they might say, unfortunately, we don't have baths at our hospital, or we don't offer water birth as an option here. And it may be disappointing, but it's much better to find that out earlier in your pregnancy than when you arrive in labour having planned to labour and give birth in the bath the whole time. That's a very specific example, but birth plans are about getting clear on what you want and helping to communicate that to your providers. I don't think that birth plans set women up to feel like they've failed at birth at all, because like I said, it's not about creating a blueprint of exactly how it's going to go. It's about listing your wishes and being able to communicate that with your care providers on the day. Labour is a big physical event for your body, so it's important to do some preparation, and hopefully this session has given you some good knowledge that you can implement for your labour and birth.